What condiments do you like on a hamburger? Did you say mustard? Do you buy the traditional bright yellow mustard? Guess what spice is in it? Turmeric. Does turmeric have anti-inflammatory benefits for your body? What about in a supplement? Is it worth spending your money or not? Coming up.
They're back. Calcium Dark Chocolate Bars, a ProCare Health customer favorite. Now available online at procarenow.com. Creamy chocolate plus calcium and vitamin D. You'll love them too. Use code SUSAN10 to save 10%.
Hi, I'm registered dietitian, nutritionist, Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast, episode number 135. Tired of all the hype and confusion when it comes to nutrition, especially bariatric nutrition? Eat this food. No, don't eat that food. Skip certain meals. Try this diet to reset your pouch, or heck, just do a detox. It's enough to make you say, forget about it. I don't know what to do. Well, I do. I know what to do. It matters where you get your nutrition information. When it comes to your bariatric surgery, nutrition is specific. So let's cut through the hype. Let's get the accurate nutrition information you need to know. Simple, actionable, step-by-step strategies that work. I want you to feel well every day. Get out there and do the things on that bucket list. I created the Bariatric Surgery Success podcast for you. You're in the right place. I'm so happy you're listening. I appreciate you, and I appreciate your time. Would you please share the podcast with someone you feel would benefit as well? And if you love the podcast, please write me a review on Apple Podcasts. I'd like to give a shout out today to Tracy, who said, I absolutely value the podcast. It's like a treasure chest of golden nuggets with so much information and tips. Tracy, thank you. I love it. Golden nuggets. The best part, though, is to hear that the information and tips bring value to you and your journey. Well, speaking of information valuable for your journey, in 2 weeks, your favorite bariatric dietitians, Isabel and Gail, will join me to answer your questions on calcium and vitamin D. Don't miss it. Back to that turmeric. That's in your favorite mustard, and by the way, also in curry powder. It's actually one of the naturally occurring plant nutrients, or phytonutrients as they're called, and it's called curcumin. And curcumin is in the spice turmeric. That's what gives it the bright yellow-orange color. And let's get even more specific. One of the phytonutrients that curcumin contains are called polyphenols. Now, where have you heard those? You've probably heard of polyphenols in grapes, wine, blueberries, even green tea. It's the polyphenols that provide the anti-inflammatory benefits you hear about in turmeric. All right, I want to go back just for a minute and review inflammation. Remember, inflammation can be a good thing or a not so good thing. Well, what do you mean by that? Okay, I'm glad you asked. Inflammation is good if it's short term. Let's say when you cut yourself and your immune system sends in white blood cells to jumpstart the healing process. Inflammation, not so good when it becomes chronic or ongoing inflammation in your body. This type of inflammation, think about it, invisible to your eye, but yet it gets all the media attention because it seems to be tied to many common diseases, from heart disease and autoimmune illness like lupus or rheumatoid arthritis, even to cancers, diabetes, and stroke. So what happens is that this inflammation in the body raises the level of a blood marker, and this blood marker is known as C-reactive protein. You'll also hear it called CRP for short. The liver produces this CRP during periods of inflammation. So it makes sense that if your body has chronic inflammation going on, that CRP level will be elevated. So doctors measure this level of general inflammation in the body with a blood test. Yes, you got it, called high sensitivity C-reactive protein, or HSCRP. So you'll hear about specific foods that promise to single-handedly fight inflammation, but that's just not how it works. For your diet to have an anti-inflammatory effect, the key is not, and I said not, focus on a single food or even a food component like the curcumin that's in turmeric. The ultimate success of the anti-inflammatory diet approach is based on synergy. Okay, think of it this way. Who's your favorite team? Basketball, soccer, football. All right, for me, it would be Tennessee Vols. To win and to continue to win, the team must work closely together. In the same way, the synergistic effect of anti-inflammatory foods eaten together provides your body the best and most powerful results. In other words, it's using turmeric as a spice along with curry powder and eating grapes and blueberries along with drinking tea. In other words, having all of these in your lifestyle as part of your diet. You're getting those inflammation fighting, what were they called? Polyphenols. But there are other phytonutrients in food that fight inflammation too. So you want to add to your diet a wide variety of fruits and vegetables. So this would be spinach, blueberries, raspberries, strawberries. Actually, don't forget Bing cherries and tart cherries. The agricultural Research Service has conducted studies on Bing cherries, and they found, and I love this, that regular consumption lowers the C-reactive protein or CRP inflammation marker we talked about earlier. Anthocyanins are one of the natural phytonutrients in tart cherries that give them their bright color. These phytonutrients are linked to, and guess what? Yes, reduced inflammation. So you can start to see that the bright yellow, orange of that turmeric, the bold red of those Bing cherries, the deep green of spinach tell you that food items contain compounds that fight inflammation. Oh, and I don't want to forget seafood like tuna, salmon, sardines, all rich in omega-3 fats that suppress inflammation. So eating fish once or twice a week is a smart goal. Also, avocados and nuts both contain anti-inflammatory compounds. So yes, turmeric can help fight inflammation from a diet viewpoint, especially when combined with many of these other anti-inflammatory foods we just talked about. So if you want to add turmeric to your food, get the most out of it by adding it to a meal that has some fat or oil, just a little bit, as well as some black pepper to help with absorption, because on its own, turmeric is not absorbed very well. Sprinkle it on scrambled eggs. I like it in vegetable soup. Try it in a smoothie. Combine it with cumin and add a little coriander. Put it in a shaker and sprinkle on the flavor wherever you want it. Say, on your fish. By the way, ConsumerLab.com tested turmeric. They tested the spices, various ones, for the curcumin content, for heavy metals like lead and arsenic, and for filth, meaning mites and insect fragments. Yes, you heard that right. Filth, meaning mites and insect fragments. Sadly, filth is common in spices. The spice rated for the less filth, let's say, less filth and less expense. Any guesses? McCormick ground turmeric. So if you want to, try my golden turmeric and ginger latte. It's perfect for a cozy day. It combines cinnamon, ginger, and turmeric. Yum. I'll put the link in the show notes. Now, notice that it calls for a little pepper in the recipe because, as we already said, that increases the absorption. I have it in there using non-fat milk, but if we wanted to up the absorption of that turmeric, what would you do? Probably drink 1% so that little bit of fat would help it. So I'll put the link in the show notes, or you can find it on the website breakingdownnutrition.com under recipes. Now, what about turmeric supplements? They're super popular, but I'm just not convinced from the research that they're right for weight loss surgery. Most of the studies are small. They do suggest that curcumin in turmeric may be helpful for osteoarthritis and rheumatoid arthritis. However, the studies show that it's not superior to your non-steroidal anti-inflammatory drugs or your NSAIDs. The typical supplement dose ranges from 500 milligrams to 2,000 milligrams, most of which is curcumin in the turmeric. Compare that amount to a teaspoon of spice, which is about 150 milligrams of curcumin. And again, we just said a dose of a supplement can be anywhere from 500 to 2,000 milligrams. A teaspoon of spice, about 150 milligrams. So you can see why it's important to take in multiple sources of anti-inflammatory foods and spices to build up and get that benefit. Turmeric and curcumin supplements are not well absorbed. Remember, we said that on their own. So what do you want to take them with? It's just like with the spice. You want to have it with a little fat when you take it to increase absorption. And what's happening now with most of the supplements is that they contain what's called a bioavailability enhancer. What does that mean? It means an ingredient such as black pepper extract that enhances the absorption of that curcumin out of the turmeric. But here's the issue. The possible interactions and side effects that could affect you after surgery are what bothered me. They include gastrointestinal issues such as nausea and diarrhea. And you already know that some of that's going on after surgery anyway and can happen if you have dumping syndrome. Because turmeric stimulates the gallbladder, if you have gallbladder disease, be sure and talk to your physician or healthcare provider first. Turmeric might interact negatively with medicines that lower blood glucose as well as blood thinners, and even other supplements that also decrease clotting like ginseng or ginkgo. But the big flag for me was the possibility for abnormal liver function. Did you hear that? The big flag for me was the possibility for abnormal liver function. Liver function can already be an issue before and after surgery, as some of you know. So adding a supplement that might make liver function worse, to me, is not a good call for weight loss surgery. I'd rather stick with using the spice and mixing it, a spice in your foods, and enjoying it that way. So before you spend money on turmeric supplements, discuss this with your pharmacist, the pharmacist where you get your other medications, and ask about possible negative interactions. Discuss the use with your medical team, with your history of liver problems, as well as gallbladder issues you may have. It's better for you to be safe up front because you are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions, which do not necessarily reflect or agree with the host, Dr. Susan Mitchell, or Practicalories, LLC.